Hello and welcome to the benefits of leveraging EDI connections for clinical exchange. I would now like to introduce your host for today, David Barth, Senior Director. David, you now have the floor.
Thank you, Connie. Good afternoon. Thank you for joining us for this webinar. As Connie mentioned, we are going to talk about today the benefits of leveraging EDI connections for clinical exchange. You can ask questions through the WebEx chat box, and we will answer them at the end of the presentation. I will give you some introductions and context, and then pass the floor over to Mike Knowles, who's the Vice President, Sales and Customer Services here at PostnTrack, for an in-depth presentation and demonstration of PostnTrack solution in that domain. But first of all, I would like to talk about the fact that, as we all know today, the EDI world presents an interesting capability of connecting payers and providers in the healthcare industry in the United States. There's a lot of connections that already exist. And here at PostnTrack, we've seen for the last few years a lot of customers trying to expand the use of those connections beyond simply EDI, typical or traditional EDI messages. And we believe that this can be done, and that's part of what we want to talk about today. Also, in the last few years, there has been a lot of research and proof points around the fact that merging clinical information with existing claims data actually boosts the outcome of care management. You can identify 2 to 3 times more patients for different intervention in care management than looking at claims data alone. Those 2 points are really important for us, and these are the fundamentals of why we think EDI connections and EDI pipelines should be leveraged for more than just administrative information and include clinical information. So today we're going to go through that, but just as an introduction, PostnTrack, we have been in business for more than 10 years and are really serving the payers, the payer market here in North America. And our role is really to help our customers connect to various and disparate healthcare data sources and help them manage the flow of information between themselves and their business partners in order to improve quality outcome as well as reduce their operational costs. So as you can see, we've been working with the largest commercial payers in the country, as well as a number of smaller payers, and we, on their behalf, reach to more than 100,000 providers across the country, either directly by connecting their IT teams directly to the payers or through intermediaries, vendors, and other clearinghouses. So let's talk about one of the possible clinical exchange in the marketplace that we think is a very easy way to start integrating clinical information into the EDI pipelines. And this particular type of data is the clinical lab results. There are 2 reasons why we think it's a good way to start. The first one is because most of the time, reporting on clinical lab results is part of the contract that payers have with providers, and also because it is a very important transaction. So clinical lab results are generated from laboratories, of course, that could be either the national reference labs like LabCorp or Quest, but also more and more by hospital-based labs or smaller regional labs. And the numbers are quite staggering. We we know that more than 7 billion of tests are actually performed every year, and that's as many reporting opportunities that can be on the marketplace. And tests are important, and we all know, and it's pretty clear. But 70% of the medical decisions are actually informed by those tests. So they are clearly a very good indication of the state of a patient or a member from a payer's perspective. So what happens today is payers need those lab results for three major reasons. One is reporting on quality, either to compete in the marketplace through the EDI standard to position themselves against their competitors and prove to their large customers like employers what kind of outcome they are capable of delivering for their employees, or even with the government with a five-star rating mechanism from CMS. Second reason would be just to actually deploy and execute the care management programs towards their members. It is needed, clinical information is obviously needed to know where your members are, and updates to that comes from various blood work or clinical tests that are made and reported to the payers. The third reason is for risk management. It is used, obviously, to build on new premiums and products. So knowing that information will obviously help. How do we do that today? Today, clinical lab result reporting is quite siloed and manual, and therefore expensive. It is generally required by contract by the payer that contracts with the provider. But once the contract is set, the process is implemented as a one-off, which means that typical scenario would be quality people need to have the clinical lab results, so they would contact the IT department, who will contact the particular lab and implement a one-off solution depending on what the lab capabilities are, whether or not an electronic link can be established, and down to the very manual. It cannot be done electronically, so we're going to send off nurses to look at the charts, and enter the data manually into laptops, which adds to the problem an issue of security and privacy, because data is now traveling on laptops. So it can really be extremely difficult and expensive, and most of the time extremely manual. So here at PostnTrack, we believe that EDI is a great avenue to actually automate the intake of clinical lab results, as well as secure the intake of clinical lab results and make it more efficient. There's a few reasons for that. First of all, connections are generally already in place. You can imagine that a payer has in place some kind of EDI connection towards most of its providers. And if it doesn't exist, it can be put in place pretty easily. It's now a technology that has been well adopted in the marketplace. And so we can expect some kind of connections to already exist. The second reason is EDI teams are actually managing data quality routinely every day. So putting a new type of data into the pipeline and having the team put in place some kind of cleaning mechanism, editing mechanism, rules-based scenario to guarantee the quality of the data that is coming in is pretty routine, and the team is well prepared to do that already. Then there's a question of volume, because as we said previously, volumes can be staggering, but claims and other related transaction volumes are also very high, for the simple fact that there are a lot of encounters. Most of the lab results actually are going to generate a claim. So it is important to understand that this is not something that people have never dealt with. And finally, what's important in clinical lab result intake is not when everything goes well. What's important is when there are exceptions to be dealt with. And the EDI teams are really geared and trained to do this, because all of their business is about catching exception and resolving exceptions very quickly. So we really believe that this environment can handle and is a great way to work through clinical lab results. So what would it look like? What a solution like this would look like? Well, there are 4 elements that we believe are important. The first one is obviously to be able to connect. And as Mike is going to explain a little further, here at PostnTrack, we really believe in an agnostic approach to connectivity. You have to meet the submitters where they are. You cannot impose a way to work, because then you will reduce the adoption of your process, and then you will have to go back to some manual brute force type of environment, which you don't want to get to. So agnostic connectivity tool, but also a team that is able to manage a large quantity of connections. And that's something that we can provide, and we do every day. The second point is transformation and quality, I would add. Data is flowing through, and it has to be taken the way it is, and most of the time transformed into a format that you can actually intake. And don't get me wrong, we are a big proponent of using standards like HL7 for clinical data, but HL7 as a format helps really to define the envelope of the data, but the content of it is really not standard yet. So if you've seen one HL7 file, you've seen one, and most of the time you will not be able to intake it as it is. So there will be some transformation involved that needs to happen. And sometimes you will also have labs that are not able to output any kind of format, so let's take what they have and transform it into something you can intake. Routing is also important, because you may have to write the file in different back offices for different reasons, as well as on the way back to acknowledge receipt. You will have to direct your messaging in different places. The quality piece means that what needs to be taken needs to be exactly the way you need it. So obviously, the solution needs to allow you to customize the level of quality you require, and actually you could be able to have different level and different threshold for different type of reports. So it is important as well to give your team a way to report on that quality. And quality means also that some of the results could be rejected, but then it's a good segue into the last piece of what the solution needs to have. It's some kind of inventory that you can make sure that you receive a complete load of what you need to intake, and particularly that whatever has been rejected can be followed through and resubmitted, so that you can have a complete picture of all your members. So with that, I will pass the floor to Mike Knowles, who will get into the demonstration of the product.
Thank you, David. I think it's important to note that the PostnTrack platform works very nicely with how the solution works. And we say, as David mentioned, you really have to have some agnostic tools that allow you to drive adoption. To get labs to use it, you need to have an ability to allow them to do that. So we built a really simple enrollment facility that works with the providers today. Very simple way for them to actually go in and use the tool to do the enrollment. And when you do so, you trap some basic information and you allow them to enroll and download and install our software, which is called the Doodad, which allows them to enter their information into the solution for users. It pulls a shared directory and sends the transactions on to PostnTrack via batch or real time directly to the payer systems, where the transactions are received and receipt and response is returned immediately with full tracking and transparency for the life cycle of those clinical transactions. Failed files are then returned to the sender, and results are delivered to the core system. So the payer has the ability to send back the failed transactions so that you can keep a running total of what needs to go back to the provider or the lab and have them resubmit them in a future state. So we're going to actually take you into the view from a payer perspective of what it looks like when you view the various transactions in what's called the Lab Results Manager. So as I mentioned, how it works is really simple. It's utilizing the existing platform of PostnTrack, and it allows you to upload your transactions, and the payer responds immediately. And the real value to the payer through the EDI is that same ability to have transparency and tracking of the various transactions completely through what's called the Lab Results Manager. And the Lab Results Manager, you log into our portal, and you grab the transactions. And it's just a simple overview. What labs are sending, what records are coming through, how many accessions, what are the results, and more importantly, what are the errors. And then a running tally. In this case, the payer has it set up so that they can see the top 5 lab errors by error code. And in this case, and it tends to be the dominant issue, is a duplicate record is what causes the errors. And then the ability to drive into the individual labs and the traffic that they're sending, with the ability to see the total number of records, what was accepted, what was rejected. And importantly, what tends to happen in labs and lab results is you have members that are not eligible. So we keep track of the number of accepted and rejected members, as eligibility tends to be the dominant issue. And what we've done for that in that case is somebody like a LabCorp, we actually push bulk eligibility to them so that they can pre-screen the transactions, so that they can cut down on the number of those rejected results due to membership or eligibility issues. So the traffic report gives you very detailed information on the site, what was accepted, what was rejected. And in this case, this is the actual subsidiary site reporting, where you might have a facility that's got multiple sites submitting, so you can really drive down and get real visibility into what are the clinical results that are coming by site, by transaction, and what their actual their errors are. And you can really drive in and drive behavior, because remember, this is still a quality issue where you're trying to get quality information out of your labs to report on that and marry it to your claims data so that you can produce good HEDIS and quality reporting, as well as what your risk management and utilization management needs to understand exactly which patients need care coordination, and looking at the clinical conditions that you can get involved in to help drive some better outcomes for your patients. We also give you the ability to set up those rules, and I think it's important to note that the payer defines the rules by which the clinical values are submitted. Do you want to fail the entire file for bad information, or do you want to strip out the bad records and send them back to the provider? Do you want to disable the ability to reject transactions based on a LOINC code? And I think it's important to note that you have the ability to set this up by lab, by site, by payer, so that you have the ability to profile this so that you can really set rules based on the group that you're working with. For instance, a large reference lab like LabCorp might have a different set of rules and thresholds than somebody like a hospital-based lab, who may need some looser guidelines so that you can get that data, because it's important. What payers are telling us, it's important to get the data. It's important to get that data into their systems so they can do their reporting and look at their utilization of those transactions. And while LabCorp and Quest are used to sending this information, as you get further down the food chain into these hospital-based labs, they're not used to sending it, and more importantly, they might not have a standard format. So you see a lot of disparity in the actual data output from the labs. With the ability for the fundamental problem of this disparate data is coming in, you, as the payer, have to define the output format that goes into your system, so that loads nicely into your medical management or utilization management system so that folks can access it to do what they need to do. So you define the actual inbound format that comes into your system as a payer, even though you know you're going to see all versions of HL7, all versions of proprietary format. We even still have some labs that are submitting basic Excel or comma-separated data that gets transformed into this format. So it's important to note that this is completely rules-based, where you decide the various formats that come inbound. And that is ever-changing. As HL7 becomes more fully formed, we're hoping that becomes the adopted standard, but as we know, a standard really isn't a standard within healthcare EDI. Standard format, not standard content, and sometimes not even standard structure in some of those loops and in some of the information categories. We also give you the ability to define the code lists. So within that format, you now actually get some content-level rules. So which code lists are you going to bounce against? What's important to you? And then more importantly, do you want to add to that or customize those lists? So where we see that happen the most is in those LOINC codes, either allowing some that have expired or adding a few that are sort of catch-alls for everybody, or defaults in a lot of cases, so that you have that ability. And there's some basic search tools so you can see which lists are in there. And again, the important part of this transparency tool is if you see something that needs to change, it's a simple change. It's not a complete revision analysis. It's, more importantly, this can be adopted and switched and changed very quickly and modified to fit your needs as they are today and as they evolve, as you're starting to see more needs for the submission of clinical data. And then, quite simply, we also give you audit capabilities, where if you need to go in and you're doing some HEDIS or quality reporting and you want to actually look up an actual accession, we give you the ability to drive into the individual results and look at those and audit them and do what you need to do from a quality perspective, which is a really nice piece of information for the various payers. So if you can envision this as you as the payer has the ability to sort of define the outputs as well as the reports and the data that you'd like to see. If the data is there, it can be reported on through this very flexible reporting and transparency tool. And last but not least, this all shows up in your transaction center. For most of our payers, like an Aetna or a Cigna, they do multiple transactions with us, so they want to see a unified view of the what might be their payment transactions, their claim transactions, their interactive 27X transactions, as well as the clinical lab results, and start to look at how they can tie all that information together and see a unified view. So really to highlight, it's a really simple tool that can be deployed with your existing EDI tools. The back end where the payer receives the transactions might be a different location, but we have a very flexible way for you to reach out and to grab those labs and to install connectivity in place with them today. We already have labs installed, so it's very easy to collect results for a new payer or a payer that we have that's not doing it. So it's a very simple to drive adoption, and it's very simple to dictate the rules by which you receive that information. And it's probably on average about a 60 to 90-day implementation curve to be up and running as a new payer or an existing payer that would want to add this on. So that's a quick highlight demo of what we're doing, and would want to know questions and want to thank you for any questions or any information that you have regarding the transactions today. Thanks again for your time, and we'll go ahead and take questions now.
Thank you, Mike. I am trying to get to any possible questions. So, Mike, a question for you that is asked by a participant. Can you set up rules by submitters?
Yes, absolutely. The tool is very flexible and allows you to take like a reference-based lab, like a LabCorp, and assign one set of rules. And on the flip side, if you want to have a hospital-based lab or a smaller lab have a different set of rules and error thresholds, it's very easy to do and very easy to set up. So all those pieces are in place today and active today.
And how many labs do you work with?
We currently work with in excess of 75 labs. The big reference labs, LabCorp, Quest, BioReference around the country. But the bulk of the labs are those hospital-based labs or system-based labs. And what we're really starting to see is one of our most recent installs is with CVS Minute clinics around the country as the growth in as a reference site where a lot of blood work is being done. So we're starting to see a lot of that come up as well. But about 75 unique submitters, multiple sites.
So a question that's the fusion of two questions, actually, that are on the same thing. Talking about, so the first question is, do we have to submit claims to submit lab results? Added to another one that says, do labs submit claims through PostnTrack?
The answer is no. This has been deployed and can be redeployed to labs for just the intake of the clinical lab results. There are a number of those labs that do submit claims to our various payers as well, but they're not mutually exclusive. So the answer to that is no. Obviously, it'd be nice to do all transactions for the labs, but this really is a tool, a turnkey solution that allows you to reach out and start gathering data for the labs on the clinical side right away without actually using any parts of the PostnTrack platform for other transactions if it's not something you're interested in.
So it's a possibility, but you don't have to.
You absolutely do
not. Next question is, what type of access do the labs have to the results?
Well, that's interesting. Right now, this is not a typical lab results viewing solution for the individual labs. This is really the data and the clinical exchange that's required of the payers to send in those results. So they have the ability to get back error reports that tell them which accessions failed and why they failed so they can fix and resubmit it, and then the payer has that complementary view so they can understand what that individual lab owes them. But there are a number of commercially available lab results viewing systems available between labs and providers that exist today, so we don't interfere with that process.
Very well.
Are there any more questions?
So no question through the chat anymore, Mike. So that will end our session. Thank you very much for participating. The session will be recorded and accessible on our website in a couple of weeks. Thank you again, everybody, for being on the call today.